Hello, everybody. Welcome today to the Project Sleep's Summer 2021 Advocacy webinar. I'm so excited that you guys are joining us. Please, as you tune in, share where you are watching from. We love to see all the different places that people tune in from. We have some really great speakers with us today. We have Matt. Hi, Matt.
Hey, Julie.
And where are you joining us from?
I'm joining from right outside of Nashville in a small rural town.
Awesome. So we're really excited to have Matt today share his advocacy experience as a sleep advocacy superstar extraordinaire. And you'll get to hear a lot today from Dane Christensen, our expert in Washington, D.C. Hi, Dane.
Hello.
So let's see. I don't think there's any other housekeeping before we get started. So let's go ahead and dive right in. We're really excited to talk about an update from Washington, D.C. from Dane. He's going to catch us up on where everything is right now. We've built such incredible momentum this year with our advocacy. So we can't wait to share where we're at and then where we can go this summer and helping you reach out to your senators' offices to continue the momentum. So with that, I think I'll let Dane take it away.
Thank you, Julie and Matt. It's good to see you. Glad you could both join us today. And for those of you that might not know me, my name is Dane Christensen. I'm Vice President at the Health and Medicine Council, and I'm one of the Washington representatives for Project Sleep. As Julie alluded to, there is a tremendous amount of momentum this year and positive news so far, and not just building from January, but building over the past few years of the sleep community really making its presence felt on Capitol Hill and putting a marker down for the need to enhance and address issues for sleep patients. So if you're new to advocacy, welcome. If you're a veteran, I want to stress that this won't be too remedial. If you've seen the summer presentation before, it is a little different this year. The Capitol remains closed. Congress is working though, so there is a little bit of a wrinkle in how we do outreach, but the members right now are back in the districts locally for the recess, and they are, of course, as always, interested in hearing from their constituents. Collectively, as we think about us doing advocacy, we are a grassroots network. We're made up of individuals across the country like Matt, ensures we don't just have Tennessee and California covered, but many legislators know about us. So really what we try to do is two key things. We advance research and improve public health for the community, for community-specific issues. And we mainly do that by asking for increased funding or additional resources for different projects and agencies. And the other thing that we do is we work on coverage and access issues, health insurance, Medicare, things that make it difficult to see your doctor or have access to a particular therapy. And often that's done through the legislative process or bills that get introduced and considered by Congress. So we're going to take a look at all of that and also where things are at on Capitol Hill in general. We're going to start broad. We're going to transition to community-specific issues. And then, of course, we're going to end with personal outreach. It'll probably be about 45-ish minutes, and we'll have a little bit of a discussion at the end. So thank you again, everyone. And if there we go. So I always hold my breath. I'm a little bit tech adverse, but there hasn't been any issues so far, though I have to admit this is one of the coolest Zooms I've done by having it connected to the live stream also. So I'm going to thank Julie for setting that up. But really quickly, this is a little bit of the Civics 101 just to get us started. Why do we advocate? What is the value and importance of reaching out to your congressperson, in this case, your senators this summer, and talking to them about sleep disorders, circadian sleep, patient community issues? And really that comes down to, just how the government is set up. We do live in a representative democracy. There's three branches of government, and Congress, your legislators, are the ones who make the laws and consider a bunch of these issues. So they have what's called the power of the purse. They're doing what's known as the appropriations bills right now. They're deciding how much money goes out to all federal agencies. That includes medical research. That includes patient care. That includes the FBI, the Department of Agriculture, and anything that the government touches. So they're making those decisions. They can make those decisions with your input or without it. Of course, prefer that they make those decisions with your input or know why certain things should be a priority. They also oversee federal agencies. They have direction over what the federal agencies are doing within the executive branch. And I think, it's becoming more apparent just how much this ties in with someone's healthcare. there are a number of federal agencies that do research. The National Institutes of Health is the world's foremost biomedical research organization. It's currently funded at over 40 billion with a B dollars per year. And that money doesn't stay in Washington, D.C. That money goes out to academic health centers and researchers across the country. They compete for it through a competitive process, and they ultimately get awards. So but anytime you hear about a breakthrough in mobility that's occurred in MIT or Boston, or if you've heard about UT Southwestern making progress on cancer, that money likely came from the NIH, but it ends up doing research in those different institutions. The VA, Veterans Administration, has a similar research portfolio, and the Department of Defense has a research portfolio as well. Neither of them are as big as NIH, but they're both meaningful, and they both have a focus on sleep. The Food and Drug Administration is, of course, a regulatory agency. It has to do with, how treatments get to market, how they're reviewed and approved, how they balance issues like safety and efficacy. And then there isn't a logo up here, but the Centers for Medicare and Medicaid Services, as the name suggests, oversee Medicare and Medicaid, but also mainly private insurance plans. So from basic research and breakthroughs in science all the way through to treatments and how they're covered by your insurance plan, the government's involved in all of that. And your elected representatives, Congress, have oversight of that process and decide what different priorities are. The expression is always at the table or on the menu. And like I said, they're going to be making key decisions, and it's better that they make those decisions with your input. Don't forget that these folks do work for you. It's a common misconception that, lobbyists and pharma and Blue Cross Blue Shield or whoever else walk around the Hill and they go to fundraisers and they do different things. And that stuff might happen. I mean, it happens less these days for obvious reasons, but offices are primarily interested in hearing what you have to say. Other stakeholders don't live in their district. They're not their constituents. You're their constituent, and they know you have a pure self-interest. This is why we always tell you, tell your story, your personal experiences and what you've gone through. How was it getting diagnosed? How was it seeing your doctor? Were you ever participating in a clinical trial? These types of anecdotal experiences have the most value for them, and that's how they improve the healthcare system. So one of the key questions that always comes up is, does advocacy make a difference? How does any of this work? I talked to my member of Congress. I told them that's important to provide funding, but it's an opaque process. It's always very complicated. There isn't a clear input and output. But, I would just, I think this slide encapsulates very well just how important outreach is. So we mentioned that the NIH is the world's foremost biomedical research enterprise. They report on their categorical spending in a number of different condition areas. So how much money went to a specific research portfolio in a given year? That's publicly reported. And this is an encapsulation of that. So over the past 10 years, what the slide reflects, the budget for the NIH has grown by about 25%. It's gone from 30 billion up to $40 billion. So they added another 10 billion on. At the same time, though, the sleep research portfolio has nearly doubled. So that has increased many more times over than the NIH increase. So this is a combination of good advocacy and a vocal community meeting good research. So the community is asking Congress to do more when providing these increases and saying there's a good need for sleep. And as they're creating these opportunities, quality researchers across the country are putting in good applications that are getting awarded. And that is why the research portfolio has grown so much and outpaced the overall budget. And something that happens is Congress includes what they call committee recommendations. They say these are specific areas that we care a lot about. Those are a couple of examples of those committee recommendations are included at the bottom. One opportunity that remains, and that I will say, is while sleep research the portfolio is growing, research into individual sleep disorders can remain relatively modest. And that $460 million there, you have so many different individual conditions that are represented. So in addition to studying sleep and circadian rhythms in general, there's also a need, instead of just doing science for science's sake, to have research into specific conditions. So that helps advance the process of better diagnostic tools, better therapies, better patient care. And that's still, I don't want to give the impression that we've already climbed the mountain. There's certainly much more to do until we see that systematic and sustained progress in each of those individual sleep disorders. So we have had some recent successes. Last year, or the fiscal year we're currently in, is fiscal year 21. So Congress was making those decisions last August, and then October rolled around and the fiscal year started. So the community was asking for about $2 billion for NIH, and Congress provided $2.5 billion, but they did it in an interesting way. They provided $1.25 billion for NIH for all the portfolios, and they provided another $1.25 billion just for COVID. So of course, we're responding to the COVID pandemic. They kind of split the money up. So this money is for all research, and then we have a pot of money here that's for COVID, but total it comes up to about $2.5 billion, but not exactly the $2 billion we're asking for specifically, but we're not going to scoff at getting $1.25 billion for the overall portfolio. The sleep community and Project Sleep in particular have been spearheading an effort to make sure that the CDC, the Centers for Disease Control and Prevention, starts doing sleep public health activities again. The sleep CDC had really been pulling back in a number of areas. Sleep was one of them. And of course, sleep is a major health issue, like you think of smoking cessation or fighting obesity or other things that the CDC is tasked with. Sleep deserves that same type of recognition. So there had been a push to establish something called the Chronic Disease Education and Awareness Program. This would be a program that had line item funding that was meant to provide cooperative agreements out to do more work on specific public health issues. That program was established for the first time last year. It had been asked for a couple years. They established it last year. They provided $1.5 million. So there's now $1.5 million for the CDC chronic disease program directly as a result of advocacy. And then there was a $15 million increase for the VA and a $10 million increase for the DoD, and sleep was once again included in the DoD program. We're going to be talking about the Senate particularly today. One thing that's important is the Senate is the entity that oversees that Department of Defense research list. They decide every year what goes on what they call the eligible conditions list. Sleep has been included, but every year a new cast of characters is deciding what's included. Sleep needs to be included again. It was included again last year. We wanted it included again for fiscal year 2022. So, what have we been doing already to date? We have led our annual sign-on letter again. That sign-on letter has reached new heights. It gets a little bit bigger every year. Now we're up to 54 bipartisan co-signers. This is a very popular and powerful letter in the House of Representatives now. And of course, that meant that all of our requests that we're putting forward in the House were considered and largely adopted. The House has marked up its spending bills, so we know the House's numbers. The Senate has to do their own bills, and then they kind of reconcile the two of them. So they negotiate the final measures, but the House largely did what we were asking. We asked for $5 million for the CDC Chronic Disease Education and Awareness Program. The House provided $5 million for the CDC Chronic Disease Education and Awareness Program. Pretty not surprised when you have 54 members of Congress saying this is a priority for us. We also called on the NIH with new committee recommendations to develop a research plans on specific sleep disorders. What is the plan moving forward to systematically advance science in each of these areas? So that was included. And then, likely will be something that will be a good point of discussion as what they call the sleep disorders entity at NIH, the National Center on Sleep Disorders Research, has new leadership and is working to assess priorities moving forward. And then there's a strong focus on health disparities and health equity, and a need for an appreciation that sleep is a health disparity issue. It's too simple to think about specific conditions that might be health disparities like diabetes and overlook something that's a major underlying factor like sleep, but sleep needs to be viewed as a health disparity and health equity issue as well. So this is an outstanding slide, but an excellent encapsulation of all the members that have joined the letter. Congressman Schiff from California has led it once again, but it is a bipartisan effort, and it includes both new and veteran members of Congress, people from all over the country, and every member that's represented on that list, there's either a patient advocate or a researcher behind them that asks them to become a champion and asks them to join the letter. So we thank you for doing that. I just want to level set moving forward.
I just wanted to add really quickly that thank you guys again. This is all of your hard work to get these representatives signed on. So this is, you might remember back in March, I think, or April this year, maybe, that we were working on this. So it's just, and what did we have, Dane? We had like, I would say 400, 500 people that were doing the outreach. And we reached almost like something like 200 different offices of different representatives. And all of that work to get these 54 signed on. So Matt, I don't know if your representative is signed on.
No, that's a nice, yeah. So that goes to show it's a long game. So you build this relationship over time. I wasn't able to get my congressman to sign on this time, but that doesn't mean I'm not anticipating he's going to sign on next time. But I'm building that relationship with his office, and so every email I send, every phone call I make, it's putting more and more development in that relationship. And so eventually we will get there. It's not a matter of you know if, but when. And just as Julie said, when you reach out to that many members of Congress, you're increasing your likelihood of getting that number. And every year I hear Julie say, I don't know if we can get that number. And then every year we get that number exceeded. And so that's a credit to everybody who made a phone call, not just the people who got those congressmen on that list. Everybody who's reached out, their voice was heard, and they're building momentum for this effort moving forward.
I think even like one of my favorites, I know Dane, we'll keep going, but one of my favorite parts about this though, is just even the fact that by you guys reaching out to these offices, I don't always think of it as awareness work, but it is also awareness work. I mean, think about 400 different people receiving phone calls and emails talking about my experience or my loved one's experience with a sleep disorder. And that's pretty amazing because that's some incredible awareness right there. In addition to all the great advocacy that hopefully all the good things will come from it.
Yeah,
so thank you guys again.
I'll just make a technical point, and that is, I'm glad you brought up the outreach of over 500 advocates, because the important thing too is that there are 435 members of Congress. Even if everyone doesn't join the sleep letter, it would be nice if 435 of them were asked and were aware of the sleep community's requests and knew somebody in their district. The letter we're talking about is not as simple as just adding a signature to it. The letter is an actual official document. You're only allowed to request so many things through the spending process each year. Every member gets a limited number. They're allowed, we'll say 10. They have to pick where they want to expend those resources. 54 members decided that their primary request was sleep. So the support is amazing. It's going to be tougher to go from like 54 to 84 people, even though we've gone from like 20 to 54. But the important thing is that 435 members are asked, and that 435 members know a sleep advocate that's in their district. So thank you again for your support. Which brings us to what's happening on Capitol Hill right now. And so this will be kind of the broader context that we're moving into. And then there's really two kind of key things that we're going to take a look at. One is the annual budget and appropriations process. We mentioned the importance of funding for those different programs, and the fact that the House has included a request for $5 million for CDC chronic disease education and awareness. So where is that spending process at? And overall, the quick summary is the House has done their bill, and now the Senate is preparing to do theirs in September. So the senators are the ones we need to check in with. The other thing is health policy, and that is what bills is Congress considering, and how are they handling coverage and access issues right now, or contemporary items for the rare and chronic disease community. They usually, usually on the coverage and access front, issues that patients are facing cut across, specific diagnoses. So they tend to be issues that rare disease patients face or chronic disease patients face. But what are the coverage and access items that are timely and relevant right now? So first and foremost, knowing that the House has done their spending bill, and the House has been very generous. So the House accepted nearly every recommendation the community was making. How much money for the VA program, how much money for NIH, the House adopted that. So the only thing we had to do was tell the House members, thank you. And we already had a feeling they were going to come through for us because so many of them signed that letter at the start of the year. So now the question pivots to making sure the Senate simply adopts what the House is doing and goes along with the House recommendations. So, the House and Senate each get to come up with their own proposal, and then they reconcile the differences. So if the House says we want to give $50 and the Senate says we want to give $100. The question is, are they giving 50? Are they giving 100? Or are they giving 75? Are they meeting somewhere in the middle? So right now, we know the House has been very generous and done everything we've asked for. Our request moving forward as we go into the summer is that we want the Senate to do likewise, either adopt what the House has done or get as close to those numbers as is possible within the federal budget. So the sleep community is requesting $3.5 billion for the National Institutes of Health. This is the same amount that was included in the House bill. And the reason this is important is because they don't, that chart is significant that showed all the different categorical spending. Congress doesn't write those numbers into the bill. They don't earmark funding for specific conditions. The best way for our portfolio to grow is to make sure that the overall pie gets bigger. So $3.5 billion will create a number of new opportunities for sleep researchers. There's a trickle-down effect there. Some of you may have heard of this ARPA-H concept, the Advanced Research Projects Agency for Health. It's been talked about a lot in the press. Biden, the new administration, the president, of course, was a key player in the cancer moonshot when he was in the vice president role previously. There's a big question, what's he going to do for research when he's back now that he's president? The proposal that emerged seems to be this ARPA-H concept. So this is an additional pot of money at the National Institutes of Health. But it is not simply what they call investigator-initiated research. It's not scientists putting in their best grant applications, being peer reviewed and getting funded. It is a different thing. It operates like what they call the Defense Advanced Research Projects Agency. They come up with specific topics, it looks like better cancer therapies, doing a good job addressing diabetes, coming up finally with some meaningful interventions for Alzheimer's or Lou Gehrig's disease, and then attacking those specific scientific questions, but adding a separate pot of money to make sure that any research going on through this different mechanism does not take away from the ongoing research that already exists in the portfolio. So the House is actually requesting $6.5 billion for NIH. 3.5 of that is for the normal budget and research portfolio, like the National Center on Sleep Disorders Research. And the other $3 billion is to get this new ARPA-H initiative off the ground. So they can also be starting to look at clinical trials and other types of large projects in specific areas. And what those areas are will probably end up being a process that involves Congress at some point saying, these are really key priorities for us. So just some food for thought moving forward. And as I mentioned, it is timely that we're going to be discussing the DoD. One thing that's not in the House bill is the DoD research component. So the military's research portfolio is called the Congressionally Directed Medical Research Portfolio. As the name suggests, it's directed by Congress. So each year the Senate writes the defense spending bill, and they put this list in that you can see on the screen. That list indicates how much money, $330 million last year, and where that's going to go, what's available to compete for funding. So sleep disorders has been on that list almost since the very beginning. The program is about 15 years old now. When it started, it was $20 million and 20 conditions. Now it's over $300 million. It's only about 30-ish conditions. It's not, so it's an incredibly meaningful opportunity, but the Senate has to put sleep disorders on that list every year. As you talk to your senators this August, tell them they need to include sleep disorders again. That's a simple request. As you work on the PRMRP, as it's called, the Peer Reviewed Medical Research Program, please continue to include sleep disorders. We've, of course, made this request through the official channels, but as Matt will tell you in a few minutes, or anyone who's advocated, the senators want to hear from you. They want to know what your priorities are. They want to know what's important to their constituents. So this is a timely request for Senate offices. The VA program also has a much more modest, it's not $40 billion, but it is close to $1 billion now. It's $900 million, but the VA has a lot of interest in sleep. They do work on readiness, insomnia. They do work on PTSD, and they do a lot of good work in sleep. So the request from the community was an $87 million increase for the VA program. If you're a veteran, if you care about veterans issues, this is a good issue to talk about with your members of Congress. The House's request is $902 million. They've adopted that $87 million increase. The Senate has only considered 3 bills so far: the Energy and Water Bill, the Ag FDA bill, and the Veterans Affairs bill. So unlike defense and unlike health, we know what the Senate wants to do on this. The Senate's recommending a $67 million increase. Pretty good. So, we don't really have a bad outcome here. We have the House asking for 87 million. We have the Senate asking for 67 million. The hope, of course, is at the end of the day, the final number is as close to 87 million as possible. So we're not going to scoff at what the Senate's done. The hope is that we get the highest allocation possible, so as close to that $87 million number as we can. And then importantly, the Centers for Disease Control and Prevention. This is a feature of our letter this year, and with the support of those 54 House members. The CDC, unlike the National Institutes of Health, has been underfunded for a long time. And COVID really put a spotlight on the lack of public health resources that were available in this country, or how kind of underprepared we were to respond to a number of different threats. So there's really a focus this year in reinvigorating public health, reinvigorating things like public awareness, professional education, surveillance efforts. So the CDC overall is potentially getting a good funding increase. The CDC's budget is only about $8 billion annually. The House is actually requesting 10.5. So they went above and beyond the community's request. And that would be great if they could get that large allocation. But importantly for us, we have this line item program that we all work to establish and is now funded at $1.5 million, the CDC Chronic Disease Education and Awareness Program. It's important for the CDC overall to get as big an increase as possible. And it's important for this line item program to get an increase. We asked for $5 million this year, so we go from 1.5 million up to 5 million. The House has provided that. We just need the Senate to provide that too. So the reason in part that the current funding is 1.5 is that when the program was established, the House had recommended 3 million and the Senate had recommended 0. And ultimately they compromised at 1.5 million. This year, the House is proposing 5. Clearly, the Senate has started to come around and hear from sleep advocates and support this program too. It's why they accepted it last time around. But let's get even more Senate support. Let's work to get our senators supporting this so that the Senate proposal is up around $5 million also, and both the House and the Senate are equal in how much they're supporting this. So that's going to take us into from funding over to coverage and access issues or health policy legislation. And really where things are at right now on Capitol Hill is there's a tremendous pent up demand for healthcare legislating. So Congress was planning to do a number of things last year. They wanted to take on drug pricing. They wanted to do Medicare reform. They wanted to pass a bill called the Cures Act that speeds how breakthroughs at NIH go through the FDA more quickly and ultimately get ready and covered at CMS and out to patients as fast as possible. So there was a first Cures bill, and now they want to have a new Cures bill. When COVID started to show up, all Congress could do, particularly the healthcare committees, was respond to COVID. They passed a number of emergency spending bills. They changed how Medicare works so people could use telehealth to see their doctors. And they provided, of course, emergency supplemental appropriations, things like stimulus checks, but that was all that they could do. They didn't have the bandwidth to tackle some of these other timely issues. So now this year, as COVID is subsiding, Congress wants to get back to it. They want to do drug pricing reform. They want to do Medicare reform. One of the important things in Medicare reform that's on the table is a cap in Medicare Part D. So if you have Medicare Part D as in dog, currently there's no out-of-pocket cap. You can spend, a percentage of whatever your bills are. They want to add a cap in so that at a certain point, you don't spend any more out of pocket if you have Medicare Part D. That's where they're at, and they're making those decisions. It's important to note one of the factors in them working on all this was the Supreme Court was scheduled to once again consider the constitutionality of the Affordable Care Act, the current system of coverage and access for folks with chronic and rare disease. And people weren't sure what was going to happen. And if the Supreme Court said, oh, this is unconstitutional, we're not doing this anymore, Congress would need to step in and have a new plan ready very quickly. The Supreme Court came out in the 7-2 decision. They said, the law is constitutional. This isn't going anywhere. So that took a little bit of pressure off Congress to move new healthcare ideas forward very quickly, but they're still going to be working on these other proposals, but they might be planning to finish them off next year, but they're making those key decisions right now. And I want to stress why the ACA decision on the Affordable Care Act matters. The ACA includes a series of bipartisan provisions that are called the 4 pillars of patient protection. Those 4 pillars are now not going anywhere. They're going to be here for the foreseeable future. And they include a couple of important things. One is guaranteed issue. An insurance company cannot deny you access to a healthcare plan because of a pre-existing condition or charge you a different amount based on something that you might have or your family might be experiencing. Dependents are allowed to stay on family coverage until they're 26. So this prevents a lot of bankruptcy, medical bankruptcy issues if you have a child that might be experiencing certain issues. There are no longer lifetime or annual caps on insurance benefits. You can't outspend your annual coverage and you can't outspend your lifetime coverage. And one thing that's a work in progress is out-of-pocket costs. They've tried to rein in out-of-pocket costs. They're working to do more. One of the things that they did do during the COVID response was they passed a bill about surprise medical billing to say, if you just end up out of network or you're getting a therapy that you didn't know was out of your formulary, you can't be stuck with a huge bill. It's wrong to do that to patients, and it's not going to happen moving forward. So that's a little bit of a work in progress, but the other protections are here to stay. One of the specific bills that they're working on is the Safe Step Act. And this is a bill that has to do with step therapy. And I'm going to dive into this a little more. This was one of those bills that was popular last Congress. It had about 130 co-sponsors. It might have been passed, but then of course they just didn't have the bandwidth to take it up. So it's back this year, but I have a specific slide. So I'll cover the part about the Safe Step Act via the slide. So really quickly, step therapy is often referred to as another name. It's called fail first therapy. So this is something that affects the physician-patient relationship and a physician-directed care plan. So you and your doctor might tell you, okay, I'm familiar with your symptoms. I know how your disease progression has occurred, and this is the therapy that I think is right for you. You get a prescription. The problem now is if it goes through a health plan, the health plan might say, oh no, we don't agree with getting this prescription right off the bat. We want you to try this other therapy first that's cheaper. And if you fail on it, then you can graduate up to different therapies. So this is okay, but it can be a real problem if you have a serious issue. What the Safe Step Act seeks to do is simply apply guardrails to make this process safer. So if your prescription is being switched to something else, you and your doctor know that is happening. It doesn't just occur as a surprise at the pharmacy counter. You're notified in advance that this will take place. Your doctor then also has a chance to then interject and resist the decision. They can say, no, this is wrong. I made this. They can either say, oh, I didn't know a cheaper therapy was available, go right ahead. Or they can say, no, this is for this specific situation, and I made this decision for a reason. And there's a process to overrule that keeps the physician-patient relationship at the center of clinical decision-making. So this is, you think of it as a common sense bill. It's one that's been gaining support. Right now, it is bipartisan. The bill in the Senate is S464. It has about 20-ish bipartisan co-sponsors, 26 bipartisan co-sponsors, and there's a bill in the House, HR 2163, that's also bipartisan. That one's gaining momentum too. That's the bill that had over 120 in the last Congress. So if you're talking to your senators, and if there's 26 that are co-sponsors, that means there are 74 that are not co-sponsors. So most of the Senate is not on this bill. Important to ask them to become a co-sponsor of this legislation. As they're working on these bigger healthcare issues, this is a bill that they should pass also. The doctor and the patient should decide what the care plan should be, and there shouldn't be an opportunity for others to kind of disrupt that and steer patients towards less expensive therapies, including if their physician thinks that there's a reason why a specific course of action is being taken. Julie, you look like you want to say something.
Yeah, I was just going to add, I know we'll get to it, but we did put a in your takeaway packets that you can provide to your senator's office. We put the at least part of the Safe Step Act. I'm not sure if it's the full or just part of it, but there are. So don't worry, you'll be armed with the information in case you can't keep track of all this. I just wanted to mention that.
This is a good segue. So if you want to do a local meeting or a virtual meeting in this context, the offices are amenable to how you want to engage with them. So a local visit with some form of social distancing, a virtual visit, which is very common these days, or some type of phone call or related meeting. The important thing is asking them and doing that outreach to set something up locally. But there's a number of really good resources on the website, including prep information that has both the legislative agenda that ticks off all those funding requests. So I hope no one's writing feverishly. That information is all there for you. And then information on this bill, the Safe Step Act. So that's the kind of legislative information that the office is looking for. That's why we say it's so important for you to tell your story. They're not expecting you to give them an analysis of why the Safe Step Act is so good. They're expecting you to ask them to co-sponsor the bill. And then if they want more, they can read the fact sheets and figure out exactly what the specific details are that might be important.
Yeah, and just a reminder, guys, we did put the link in the video description, and I'll add it again, but where you can get all the takeaway materials.
So if you want to find your senator, really simple, your state has 2 senators. If you email Jackson Rao in my office, rao@hmcw.org, that's Hotel Michael Charlie Whiskey.org, Jackson will tell you who your health LAs are in your Senate offices. He can connect you with them directly. He can provide you with their contact information to make it easy for you to send a message to those staffers, either a personalized note, those leave behind materials Julie was referencing. Jackson is an excellent resource. He's happy to help you out. If you know a little bit about your senators already, you can also contact them by simply going to senate.gov. If you pick your state from the drop-down list, it will show you both your senators' websites. It has their phone numbers on it. It will have phone numbers both for the DC office, which is a 202 number, and any local office. So you probably have 4 or 5 local offices across your state. You're of course welcome to reach out to one of those offices that's close by to talk with them as well. So you can reach out through senate.gov, but I will warn you, a number of offices are completely working remotely, like a lot of businesses are these days. So if you call, the phone might just ring and you might leave a voicemail. They might call you back a day later. If you email Jackson, he can definitely just connect you to the health staffers right off the bat. Julie, is there anything you'd add to the process this year?
No, just email Jackson. I think that
makes it easy.
Yeah.
And if anyone's got a little bit of concerns about how to do outreach or, what's it like, there was a time when all of us were doing our first meeting. And one of those folks who can tell the story so well is Matt. So Matt's an excellent advocate. He's now well known for both his senators and his local congressman. So Matt, is there any advice you would give to folks that are maybe just done this a couple times or have never done it before?
Yeah, thank you, Dane. So whenever you start off, there can always be some anxiety, some apprehension about how to make that connection. And so when you walk in, you've got this request, but it's all prepared for by Project C and by Dane's team. And so you're going in and you're telling your story. So all you have to be an expert on is your story. And so when I go in, I try to make sure that I'm, talking candidly back and forth. These folks put on their shoes just like you do. That they lace them up. They're normal individuals. They're usually friendly, affable folks. You don't have to agree with everything from your senator or congressperson's office when you're talking to them, because we're asking a bipartisan ask. This is something that, everybody sleeps. Everybody knows somebody with a sleep disorder. So you already have an inroad with that. I like to look before I go in, before I reach out to a certain office and see what some of the passions, what some of the career path is of an individual, see if I can actually make a personal connection. I happen to have a relationship with my senator's son from way back in the day when I was in Boy Scouts, and I can reference that. I also know that, you know, she has grandkids. Well, I've got young kids as well. And so I try to find ways to connect and relate. And by doing that, they then remember you moving on. One of the best lessons I ever got was sitting next to Julie in Cinder's office. This was in Washington, and she we were talking to this young man, and we asked. She made the question, "Well, do you know anybody living with narcolepsy?" He had given no presentation that was actually something that he was even registering what was being said. He was just kind of nodding his head.
I think we
And
said,
then,
Matt, I think we said, are you familiar with narcolepsy?
yes, that's
And
right.
then he nodded.
Mhm.
And then I think I went for kind of this, he probably doesn't really know narcolepsy, right? And so I said, oh, like from the movies or like from a loved one. And
Mhm.
we won't, you know, go into details, but he did say that he knew someone personally.
Yeah, and moving forward, that has been a great relationship. I can reach out to this person, I can ask them about that family member, that person that they know, and it just builds rapport back and forth. It's been to the point now where we jokingly he kind of invited myself and my daughters to come visit the office when COVID is over. And so that's what you're looking for when you're building a relationship. You're talking about who you are. You're just selling yourself. You know, you have so much to offer this community in terms of your voice and your story. And so find a way to connect with that office and realize that yes, it can be intimidating, a little nerve-wracking, but once you sit down, it's just a conversation. You know, they have the paperwork. They know what you're asking based on the paperwork you're providing. They want to know you and they want to hear from you because you're a constituent. You're one who actually speaks out. So they're going to hear what you have to say. It does sometimes take some persistence in getting an appointment in a local office, but it's well worth the effort. Um, Personally, you know, looking at how I'm going to approach it, I'm probably going to see if I can do some Zoom meetings because I feel face to face, you know, I have a little more to offer, you know, when you can see my expression, when you see my tears, and when I'm talking about family, you know, they just get to know me a little bit better. And so that's how it goes. And yeah, just approach it. You know, I made beard jokes with the fellow there on the left. You know, that's how I did icebreakers. And I'm not saying that you know, Julie can make a beard joke, but find a way to, you know, to relate and just make that difference so that the next time you reach out, they're gonna go, oh, that's that guy with the beard, or that's that guy with the kids. And it just makes all the difference in the world, especially when you treat them, you know, like you want to be treated, respect, and just ask questions about them and build that dialogue.
I think one of my favorite things that you do so well is I think you always make a point of mentioning being a dad. And I think that's really important because I think a lot of us have different aspects of our life. We have relationships, but we don't always think to say those things specifically. And so I think it can just be important to sort of mention if you are a parent or you know, if your sleep condition has affected loved ones, mentioning those relationships, because everyone has relationships. Everyone knows what it's like to be a parent. Not everyone, but you know, anyway. So those kind of things I think are really powerful. So I think Matt does that extremely well, making sure to remind people of his role as a dad. So I love that.
Thank you, Julie.
Thank you both. And that is an excellent transition to making an effective visit. So there really are two good opportunities this year. And I want to point out that everyone should feel comfortable with kind of their own level of involvement. So if you just want to send the staff a message and connect with them that way, that's what you're comfortable with right now, please go ahead. Like, start that conversation, make sure they know you. If you do feel more comfortable having an actual 15-minute meeting with them or going by and seeing the office in person, that's right down the street. You can't go to the Capitol Hill offices unless you have a special invite. but you can go to the local office possibly if they're open, but it is a dynamic environment. So either Zoom or in person, there's really a couple of key things to remember. And either way, if you're doing a Zoom or in-person visit, one thing I would say is if you have a local support group, if you have other people that you talk to on Facebook, for example, don't feel like you have to go in alone. Try to go in together if you can, even if you have one or two other folks with you. They might be from a couple towns over. They might even be from a different state, but if you are going to get a chance to tell your story and lead that discussion, if you feel more comfortable doing it with people that you regularly talk with, do it with them. The important thing, though, is that you do it with your own senators. So if you're from Utah, you're talking to the Utah senators. If you have a friend from Wyoming, they're talking to the Wyoming senators. You don't talk to the Wyoming senators and have them talk to the Utah senators. The thing that they care about most is that you as the constituent are part of the discussion. But if you feel more comfortable working with some others, try to do it together. But really, there's a couple of key things when you do a Zoom or an in-person visit. You want to be on time, of course. The staff have very complicated schedules. They might be a couple minutes late, but you want to be on time and check in on time. Always make sure to introduce yourselves. There's a few things that people tend to brush past because they're thinking about the legislative issues, and these things are very important. Tell your own story and take some time with it. So how was it getting diagnosed? What therapies are you currently on? Have you been part of a clinical trial? Were you have you found out that people don't know a whole lot about the condition that you have? So tell your story. Also make it local. Do you have kids that are part of the local school? Are you are you a Boy Scout troop leader? Things that connect you back to the community. You're part of that local organization that they represent. And the other thing I would make sure you explain is if you have it, explain a little bit about sleep disorders. If it's narcolepsy or Klein-Levin syndrome, assume the staff don't know very much. And as Julie noted, their experience might be limited to things in popular culture or TV. Give them any of the background, but you don't have to read WebMD. You can explain how it's manifested for you personally, but give them the frame of reference they need for the condition and that they know that this is a healthcare problem for you. The last thing you're going to do is introduce those different asks. These are the funding recommendations we have. We like you to co-sponsor this bill. Make sure they have the leave behind materials because that's what they're going to reference as they try to follow up on your requests. And then as always, thank them for their time. And as Matt pointed out, this isn't politics. This isn't who wins in an election. This is policy. We don't have any partisan tilt. You should have an expectation that any member you're talking to is going to be responsive to your interests, but you're solely there to represent the sleep community and to explain, raise awareness and then ask them for help on these specific items. So I would give a little bit more of a primer on Zoom, but I think we're all pretty familiar at these dates. The one thing that I would say is if you do a Zoom meeting with an office, not every office can join with their camera active. So I wouldn't prepare like a slideshow or anything. If you get a chance to talk to them, I would treat it almost like it's a phone call, or at least be prepared to do it that way. And of course, our office in Jackson will help out as much as we can. And then as we stop thinking about, what's right in front of us, which is August and connecting with our senators locally, we do have some fall events that are pretty notable too. So Julie, I'll hand it over to you.
Yeah. And I just thought you did have a really good point there that was in the slide. And I wanted to emphasize it, as you said, like to get business cards. And I guess, as you're setting up these meetings, you might already have their email, and doing that follow-up is really important because as Matt said, it's about building relationships. It's not just a one-time thing. In fact, I think if they think that they're only going to hear from you once, then maybe they don't really have to pay much that attention. And so our persistence as a community, I think, is our strength. And we are persistent because, as Rachel has been noting, and some other folks on our Facebook Live, these are very serious conditions. And so we are very motivated, and we want to show that through our follow through over time. So, as you're talking with them, we do have these asks, but also in the back of the packet, there is also a fact sheet about World Narcolepsy Day for your senators' offices, which I think is also a great other thing to mention when you're there, because it's not actually like as legislatively focused, and you can ask them to see if they could show some support, maybe over social media, or at least let them know about the day, if that is of interest to you. And I think that's another good thing for relationship building. Also we have the Sleep Advocacy Forum, which is going to be coming up in the fall. And that's just for you guys to know about too in general. It's supposed to be in Washington, D.C. It's supposed to be an event we do in Washington, D.C. We launched it last year. So it was virtual last year, and it's gonna be virtual again this year. We have the videos. We have some of the videos from last year's forum up on our website. And if you haven't checked them out, it's an incredible group. We're trying to bring together different groups, organizations that represent different sleep conditions, along with professional societies in the sleep space, along with drug developers, device developers, along with the government funders at NIH. And also last year we had a presentation from the FDA. I think hopefully this year we'll talk to some other government agencies about their sleep programs. So it's a really incredible opportunity to dive even deeper over a full day with us on all these different things that we've been talking about today. And so that's going to be virtually this year. And we will also have videos up from that after. So yeah, I think that's it. Let's see if we have any, we did have one question. I think, is that next, Dane? Questions?
Absolutely.
Okay, we did have one question. You know, some people might feel, and I know we've already said it, but maybe we could just reiterate it. Some people might feel like they already know who their senators are and that they're not going to be kind of like interested in their requests. And could we just, you know, maybe just say once more kind of about still the importance of doing the outreach?
Absolutely. And go ahead, Matt.
No, I was just gonna say, yeah, I can't speak enough to that. Just because you hear a no last year or last time doesn't mean you're gonna hear a no now. The more they hear this request, the more serious they're gonna realize this is an issue to you. And just because you may disagree with certain aspects of a senator's office, that doesn't mean that they're not willing to work with you and not willing to listen. When you approach respectfully and say, hey, this is something that's still really important to me. Please have, can you hear me out? I'd love to talk with you. Sometimes I have to tweak my approach. Maybe I wasn't speaking in a way that they could hear me. And so look at what I can do differently, but always keep pushing forward, because when you do hear that yes, all that work comes in full play. Also, you don't know if they've already been, reached out to by another advocate. So now all of a sudden they have two voices saying the same thing. And so just remember that it is so important to keep that persistence up.
And the only thing I would add to that is, in regards to the letter or the funding requests, there are probably more supporters that didn't sign the letter. So even if they didn't sign the letter publicly, the process of requesting additional funding and saying you care about certain priorities is confidential on Capitol Hill. It's not public record. So there are probably offices that didn't join that letter that still supported the sleep community's request through the internal process because they were asked. And if, for example, you're doing outreach on a bill like the Safe Step Act, and the office says, we don't think we're going to co-sponsor this, they should at least give you an explanation for why. They should tell you why they're not going to do something. So, but I think to Matt's point, it is a process, and at a certain point you break through. But the most important component is that they know you, and they know that the request that you're making, it is always worth your time to make the ask.
Yeah. I thought I was going to say something and now I can't remember. Of course that happened. And I guess, I was going to bring up an example of an office. It was the representative office this year, but there was a new outreach that we had to an office that maybe wouldn't seem as into it. And my goodness, they were all about it. And it was just over email that the request was made about the letter. And then the congressional office asked to schedule time to talk to that advocate who was a parent of a person with narcolepsy. And they scheduled a Zoom together, and they took half an hour hearing that family's experience with narcolepsy. And I could have cried just even hearing about it. I wasn't on the call, but there are real people that are working in these offices, and you never quite know who might take an interest. And again, the awareness that you can raise, because also real people could be affected by sleep disorders or know other people who might be affected. And so if they have somewhere in their head, say, gosh, I think I actually heard about a sleep disorder once, then that's still something that is doing good out there, I think. So.
Yeah. That did bring up one thought, Julie. All you really need to have prepared is like a 5 to 10 minute speech. You're not going to typically have a long, drawn out, presentation. So, if you wanted to practice with a family or loved one before you go in, that way you kind of have an idea of what you're talking about, how you want to present it. I found that to be really helpful, kind of as some prep before I go into the office. So I'm prepared. I know what I'm going to say, and then it's just a matter of delivering something I've practiced.
Yes. And it probably ends up really being like a few, it's like you say a few sentences, then they ask you a different question and you kind of end up, it ends up being a natural conversation. Rachel has another question about going in person locally. I think she's asking, is that preferable as DC? And I'll just say quickly, we've scheduled this for the August recess when members of Congress are going home, I think. And so it might even be some of the DC staff that's in the local offices. That's happened to me. So I got to meet with my the really DC based staff member while they were home in August visiting with their member of Congress. So it really any outreach, anyone in my senator's office, I've met with people locally and in DC, and for whatever reason, I found the local office visits way more relaxed and a way better opportunity to really dive in. And I think that can be so I've really liked my local visits. I feel like when you're in DC, there's a million things happening. People's time seems to be, really short. And so the local visits have felt, I think, more conversational and establishing good relationships.
Yeah, it definitely is a Nashville pace when you speak in Nashville versus the DC hustle and bustle. And so there's a little more time given the conversation. I was able to speak with somebody maybe a step above of where I might have gotten in DC, just because that's who was at the office. And it was somebody who had the senator's ear. And, I was able to get my story across. There was some good back and forth. We talked about local, places we've been, and it just seemed, as Julie said, more natural and easier flow to it.
Yeah, Rachel, and if you can't drive, that's okay. Zooms are great. So you can just request a virtual meeting. Definitely. All right, I don't see any other questions here. So I think we'll go ahead and sign off. We've been almost an hour. Thank you guys so much for tuning in. We really appreciate your advocacy and your support. This community rocks, truly rocks the advocacy world. And we're so grateful to Matt and Dane for joining us today and for all of their efforts to support this community. So we'll hopefully check back in with you in the fall and hear about some good momentum continuing after the Senate continues to support our requests, right?
Absolutely.
Guaranteed. Thank you, guys.
All right. Bye for now.